I'm Katie. I'm the Community Engagement Coordinator here at the Lemon Grove, which is a really fun made-up title that Marissa and I created for me after I knew that I had to be a part of Lemon Grove after my birth, because Marissa was my birth doula, and then I was like convinced after my labor that I had to be a doula, which you will come to see in my story that it makes sense that I was like very quickly like, yes, I'm doing that. New career, total life overhaul, I'm in it. I'm fully committed. And then I got home and I was like, oh, I can't do that right now. I have a newborn baby. Like, I have a newborn baby. What was I thinking?
That's how I'm going to answer my next phone call.
And so I just kept putting it off and saying to Marissa, like, yes, I would love to do the training, but not in October, but like maybe April, but like maybe the next October. Like I just, and then eventually someone else on the team, I was here for a new parent kind of like support group meetup thing. I was the only one that showed up with the two doulas, and they had like other kids here, and it ended up being this great play date, and it was fun, and we made the most of it. And while all of that was happening, they said, you know, Marissa has us like doing event stuff a couple hours a week, but we think she could use some more help, but I don't know that she's gonna let us help her. And I was like, oh, don't worry, I'll call her. And I called her and I said, hi, I would like to work for you 10 to 15 hours a week, and here are the things that I can do, and how do you feel about it? And it took some time, and now it is great, and it has become one of the best partnerships and working relationships that I've ever had. And it brings me here to the Lemon Grove to do such important work and to allow other people at the Lemon Grove to really focus on things that they are passionate about and good at. And you know, I get to just do the behind the scenes stuff most of the time. The last time 2 times ago when I did a story share, Marissa almost peed herself. So I'm just checking in. Are you good?
Yes. So I the yoga ball here at the chair. And made like a fart.
Yeah. See, this is where we go. And cut.
I'm surprised nobody heard it because it was very loud.
Cut.
I love that we don't want to cut when you're like, yeah, it took some time for me to wear her down. Yeah, in controlling ways. Or that we hadn't imagined there was one person.
It's fine.
It's your story. Please.
It's fine. All of these things are great. Don't worry about it. All right, we're back. And so I was super excited that we were having this story share tonight on this really heavy topic, because it, for me, is the thing that I was the most concerned about going into pregnancy. So for those that don't know, I have been pregnant twice. I have one living child. And the journey to both of those pregnancies was challenging. I feel like the stories we've heard so far, I can take all of these like bits and pieces and be like, oh my God, yes, I've been there. You know, you both kind of shared about being gaslit. And I think that being a woman, identifying as a woman, being in a medical space, talking about pain, talking about mental health, these are things that naturally lend themselves to people sort of not believing you or not taking you seriously, and you're screaming into the void, and it is incredibly frustrating. For me, add to that being fat and being older than the average parent, and being newly queer identifying, and being undiagnosed neurodivergent, and all of the things, and you know, growing up as a fat kid, having medical trauma, because every single time I went to the doctors, I felt like I was going to get in trouble. I took my daughter to her 1-year physical today, and I looked at my husband in the car and I said, why do I feel anxious? And he was like, I don't know, like, you're always anxious. In the best way, you know, he wasn't dismissing. He was just sort of being like, I don't know, like, what are you feeling? And I said, I think I'm anxious because I'm going to go to the doctor's today with Francesca and I'm going to get in trouble. And he was like, why would you get in trouble? And I said, well, because I'm sure that something's going to come up and they're going to tell me I'm a bad mom. And I think that so much of that is because when I was a kid, when I was a teenager, when I was pregnant, all right, my whole life, I've gone to the doctors and somebody has said, how could you let this happen to yourself? So mental health is even more challenging, right? Because there's no physical, or a lot of times there isn't a physical manifestation. Or if there is, in my case, people say, well, like, you're fat and you're lazy, so of course you're depressed. If you would just exercise and eat better, you probably wouldn't be anxious. I know you could totally get pregnant if you just relax. We can do IUI and then IVF, but you have to have weight loss surgery first. Everything has always felt like a barrier. So when I first went down the infertility route, I knew, you know, I said to my husband when I met him, when I was almost 30, I said, hey, just so you know, like, if you want to have kids with me, like, I want to have kids, but I don't know, like, if it's going to be easy or not, because I was told that I have PCOS, and when I was 29, they said, if you meet someone that you want to have kids with, you should hurry up and do that. Don't wait for the house and the dog. Direct quote. And, you know, I sort of was like, I don't want to scare you, but, yeah, if you want to do this thing, we better, like, figure it out. And, we basically, you know, we got married during COVID, none of our plans, right? All of our plans went out the window. We got married in our backyard of our condo and everyone was on Zoom and we had 6 people in our backyard and it was the most perfect, spectacular day in every single way. But it also felt incredibly like us, incredibly like me, because like, of course it couldn't just be the typical thing that I wanted. It couldn't be the thing that I had planned that I wanted because it's my life. So something terrible had to happen. The shoe had to drop, you know? And so after we got married and had our new condo, we very quickly were like, okay, let's just stop using birth control and we'll try to get pregnant, see what happens. And it was, you know, probably like a year-ish of really trying, right? Like counting the days on the calendar and doing the very unsexy, like, hey, baby, I'm ovulating, you know, like there's, and it was hard, and it was COVID, and we were alone, and it was hard. And then a colleague that I knew from my relatively new job had a lot of challenges with her own pregnancies, that had multiple miscarriages, and swore up and down she had the best fertility doctor. She was like, you gotta go see this doctor. And I went to see her, and the first thing I noticed was that when I walked in the waiting room, every single chair had arms. Now, for most people, they don't realize that that's a red flag. But for a fat person, that's a huge red flag, because it instantaneously makes me think that this office is not going to be accessible for me. And at that point in time, I really had just started to come into my own identity as a fat person, as someone who lives in a larger body, and as that not being a negative thing. And I had worked really hard to nail down that identity before we got pregnant, because I didn't want to pass on the trauma that I had dealt with as a child to whoever I was going to mother. So we go to the doctors, the fertility clinic, and truly they say, oh, well, looking at your BMI, we'll consider doing IUI for you, but if we ever have to get to IVF, you'll have to have weight loss surgery before we would even consider it. And then I started looking at other clinics, and every other clinic had a BMI limit. I wasn't even able to be accepted as a patient. And then I started looking at adoption, and I found out that there are multiple countries that don't allow for international adoption over a certain BMI because it is a health risk and you can't possibly parent while fat. So we went back to the doctor that I didn't really love, and we started the process of IUI. And I really just got through the whole process by trying to make light of the situation. I mean, I called it the turkey baster method to everyone I talked to. And lucky enough for us, we went through one cycle of IUI and got pregnant. And I was thrilled. And I didn't know to be anxious. I didn't know that I should be nervous. I just thought, like, oh, it finally happened. Something went right. And I had all the normal things. I had morning sickness. I had all of a sudden, I had this connection with all of these people because I got to say, like, I was pregnant. I was going through it, and I was finally doing something that my peer group was doing at the time that my peer group was doing it. And I felt like I belonged, and it was awesome. And, you know, besides morning sickness, after 12 weeks, I felt good. And we had a pretty normal pregnancy. And then I got to my anatomy scan appointment on December 19th of 2022. And we went into the anatomy scan, and I had been warned, hey, when you go in for your anatomy scan, because you're in a larger body, a lot of times they can't see what they need to see. It's not your body's fault, it's technology, right? But the ultrasound isn't able to get through adipose tissue as well as it is muscle tissue. Okay, fine. So my body positive, size positive OB had warned me. You're probably going to have to do a longer test. You might have to go back a few times. You might have to go later than some other people would go, but it's fine. It's very common. So we go and we're chatting with the ultrasound tech, and I'm clearly not shy, so we're just having a grand old time. And as anybody who's had an ultrasound knows, the ultrasound tech is not supposed to tell you anything.
Right.
And we had many ultrasounds at this point, because when you do IUI or IVF, you're heavily monitored. When you're in a larger body, they can't do some of the external measurements, so they rely on ultrasound from a very early time in your pregnancy. So I was used to this kind of dynamic. And I'm looking at the screen and I'm like, oh, look, there's her face, there's her leg, And we knew it was a girl at this point because we had done the non-cell testing early on to look at chromosome count. And, it felt really real. We're like looking at her on the screen and I'm like so excited. The ultrasound tech is, oh, she's moving, look at her move. And then she just goes quiet. And I looked at my husband and I was like, And I said, oh, do you need me to turn? Like, do you want me to turn on my side, or I can turn on my other side? Like, do you want to see these other angles? No, I'm just gonna go get the doctor, and I'm gonna bring her in, and we'll be right back. I'm not sure what I'm seeing. And so the doctor, maternal fetal medicine doctor who I'd never met, comes into the ultrasound room, and she looks and she says, okay, well, what we're seeing is that there's a cleft lip and palate. and we're seeing some facial abnormalities. And I said, oh, no problem. My cousin was born with a cleft lip and palate, and she had all these surgeries, and like, oh, Boston Children's Hospital is so great, and so many kids are born with that, and no problem. We're good. And she said, well, we're having some trouble seeing the midline of the brain. And I said, what does that mean? Well, your brain is, develops in 2 hemispheres, and there's a clear line between the hemispheres, and we should be able to see that. Oh, can you not see it because, is there something about my body that's not allowing you to see that clearly on the imaging? No, we just can't see it because it's not there, and we need you to go in for more testing. And at that point, I looked at her and I said, I need you to tell me honestly, is there a possibility that I'm going to terminate this pregnancy? And she said, yes. So on December 19th, we drove home, and I remember sobbing the whole way home, calling my mom, there's something wrong with the baby. Looking up, the chart and the clinical notes and Googling terms and doing everything you're not supposed to do. Making the appointment at Boston Children's Hospital to have a fetal MRI and an EKG and an additional ultrasound and a meeting with a neonatal neurologist. And on December 23rd, we went to Children's. We spent the entire day at Boston Children's going from test to test. And then we got home and we had a virtual visit with the neonatal neurologist. And 20 minutes before the appointment, I got a message on my patient gateway that said the social worker and who else was it? It was a social worker. Oh, and the genetic counselor will be joining our call. And I said, oh, they're going to tell us that something is really wrong. Because they didn't even wait until the call and then say, now you can go see the social worker and the genetic counselor. So we got terrible news, and we found out that our daughter had holoprosencephaly, which is when the frontal lobe of your brain does not form in 2 hemispheres and instead forms in 1. And it's a spectrum disorder, so there's a lot of different potential outcomes. But in our daughter's case, they told us that she probably had 3 to 6 months life expectancy, that the entire time she would be on a feeding tube, having seizures and in pain, and that she would be born with severe facial abnormalities, and that there probably would be more, but they couldn't tell us anything else yet. And they said, we will do everything that we can to support you in whatever your decision is, but you are 19 weeks pregnant, and in the state of Massachusetts, you have until 24 weeks if there is a medical need. So if you'd like to terminate your pregnancy, you do have some time to think. So December 23rd, we decided that we were going to terminate our pregnancy. And then we had to wait because the week between Christmas and New Year's, all of our providers were on vacation. And nobody could give me a straight answer. And I then went through the process of having a late-term abortion on January 6th, 2023. So between when we found out, December 19th and January 6th, I adamantly decided that I was going to name our child because I needed her to have a name. I needed her to feel real. And we were given a choice for me to be induced and go into labor and have a baby that was then going to naturally die after a few hours, or we could have the medical procedure and have the abortion. And I said, respectfully, there's no way in hell that I'm strong enough to hold my baby that's going to die. I can't do it. Still not really sure that I made the right choice. I know that I made the right choice to terminate the pregnancy, but I am not sure that I made the right choice to not see her face. But I didn't expect that what would come from losing Ellie was so many things. Being postpartum from a pregnancy that you have terminated as late as I did meant that my milk came in, and I was told that I should wear a really tight sports bra and just suck it up. It meant that I had to tell lots and lots of people that I was no longer pregnant. It meant that I had spiraling disordered eating thoughts around the fact that I desperately wanted to shrink my body because my body was a representation of the fact that I was pregnant, and I wanted people to know that I was no longer pregnant, but I looked the same. And I was crawling out of my own skin with anxiety. And I had already been diagnosed with anxiety and depression. And I had been medicated since 2020, and I threw myself into water aerobics after I lost Ellie. It was like the greatest thing ever. I needed to be around like a bunch of white-haired ladies sweating it out in the YMCA pool. And it was great. And I still go, and I love water aerobics. But I was at the Y 3 hours a day. And I still felt like I was crawling out of my skin. And I was in between therapists. And I finally found this therapist that now teaches or leads a support group here at the Lemon Grove, which is wonderful. And she was the first person to tell me that maybe I had anxiety and depression, but also maybe I had ADHD. And maybe if someone could validate that and work through that I might get some relief. Fast forward 6 months later, I had an evaluation. I do, in fact, have ADHD. Everything started making sense, and I realized, oh my God, I'm not lazy. I'm not just a fat, lazy slob who's depressed and anxious and has control over these things. My brain just works differently, and that's okay. And there's a way out. And that was a huge turning point. So when we eventually went through the process of having Ellie's remains genetically tested, finding an actual genetic component that I passed down to be the likely cause of the holoprosencephaly, and then going through IVF and having genetic testing before we transferred embryos, which was such a gift. By the time we started going through all of that process, I knew, okay, I have anxiety, I have depression, I have ADHD, I have PCOS, I'm fat. What else? Oh, right. Medical trauma from my abortion, keep it coming. So when I first met Marissa and did our intake call for working with the Lemon Grove as our birth doula, I said, look, I know that something is going to happen to me after I have this baby, and I just need to stack the deck. I have a therapist, I need a doula, I need who's in the bullpen, right? Because I'm gonna need everybody to be on watch. I printed out the symptoms, signs and symptoms of every perinatal mental health disorder I could think of and put them on my fridge and made my husband memorize them and said, if you see any of the following, please call somebody. Because this was also the time frame when there was that horrible case in the news in Duxbury, and then a horrible case in the news in Andover, and we were seeing perinatal mental health, particularly perinatal psychosis, at the forefront of the news. And I said, that's gonna be me. I know it. I'm all I've ever wanted my whole life is to be a mom, and I'm gonna be like the psycho that like someone needs to save me from myself. And I think it was really hard to go through that second pregnancy and not think the entire time, when is the shoe gonna drop? When am I gonna lose my mind? And on top of that, being medically gaslit and told you can't be on ADHD meds. Like, this is great that you got a new diagnosis, but if you ever wanna get pregnant, you can't be on those meds. And this is where I have to give a huge, huge, huge shout out to Brigham's team, because say what you will about birthing at Brigham in terms of intervention, but they have a women's health psychiatry team that is absolutely life-changing. I told my doctor, I'm crawling out of my skin. I can't get anything done. I don't know. Is it because I'm pregnant? Is it because I have anxiety? Is it because I have ADHD? What's going on? I'm literally sitting on my couch and I'm stuck. And I can't do my whole pregnancy like this. And she said, well, did you talk to the social worker? And I said, no, I didn't know I was supposed to talk to the social worker. And she's like, yeah, I'll get you a referral today. And the social worker called me that afternoon. And she said, who told you couldn't be on meds? And I said, literally every doctor. She said, well, I can't tell you that you can be on meds, but I know somebody in the women's psychiatry team and they can help you. And I'm pretty sure you can be on meds. And I started seeing my psychiatrist, and she said, yeah, no, we gotta get you back on Adderall. Like, you need to, you're clearly not functioning. And we talked about it, right? And we talked about, unfortunately, the issue being that the reason they don't prescribe meds is because there haven't been enough studies done. And the only studies that they have about stimulants and pregnancy are about misusing cocaine and methamphetamine and the effects that it has on our children. And that there's a correlation between mothers who take Adderall and then their children eventually taking Adderall. Well, there's a strong genetic component between mothers who have ADHD and their children having ADHD, so this could be the reason. And thankfully, this lovely psychiatrist said, okay, are you comfortable with all of these side effects and this information I'm telling you? And it's definitely still your choice, but I'm telling you it's safe, and like, let's get you some help. And I've never looked back, and it is truly the greatest thing that has happened to me, because I wouldn't be able to parent if I couldn't handle my own mental health. And it's not a cut and dry answer. It's not an easy road. There still are days and times where I think, oh, what if my car just went off the side of the road? Or what if I just walked into the ocean in like a long white nightie and just like let the tide take me? It's like a deep fantasy. And I, but it's not perfect, but it's so much better because I have the team of people around me. And the village that I have found at the Lemon Grove and with my very, very impressive stacked team of providers. And this is the hill that I will die on, because everybody needs access to this and everybody needs to know that they're not the only ones.